Hi, my name is Jordan, and today I'm going to be demonstrating IV therapy. So the first thing I want to do is verify the physician's order, and then I'm going to go into my patient's room and perform my wipes. So I want to begin by washing my hands, and then I'm going to identify the patient's name and date of birth, and then also check if they have any allergies. After that, I'm going to protect their privacy either by closing the curtain or shutting the door. And then lastly, I will educate my patient as to what I'm doing and why I'm doing it. So the first thing I'm going to do is put on some gloves. These gloves do not need to be sterile. They can just be clean gloves. So once I do that, I can come over here to my patient and look at their IV site. So right here is the IV site on my patient's arm. I want to check the insertion site to be sure there's no leakage, if there's any redness, swelling, if it's warm to touch. And I also want to ask the patient if they're experiencing any burning or pain at the insertion site. If there's any abnormal findings, I will document them. But everything seems to look good. So now it is time for me to start my procedure. So I do have all my equipment here. Everything is in its packaging already, so I'm just going to remove the packaging. I have my IV solution bag here along with my tubing. I have an alcohol prep pad, and then I have a syringe with normal saline solution as well. So the first thing I want to do is take my tubing here, and it has a roller clamp, and I just want to make sure that this clamp is all the way down, just locking it. That way I'm able to do the next step. So the next step would be taking my spike here at the end of the long tubing here, and it does have a cap on it, so technically this is sterile underneath. And then I'm going to take my solution bag. So this is normal saline solution, and it does have a blue rubber stopper here. I'm going to begin by taking my spike cap off. So now this is sterile, and then I'm also going to take off this blue rubber stopper, which is also sterile. So now this is sterile touching sterile. I can spike my solution bag. Once my solution bag is spiked, I am able to flip up my bag, and then I can hang it at the appropriate height here. So here my bag is hanging, and I have all my tubing, double checking that everything is locked here before we begin priming. So now that I am ready to prime my tubing, I'm able to see this chamber here. So I do want to give this chamber a couple squeezes to ensure that it is filled about 50% full. And then once it's about 50% full, I can actually unlock and unclamp this here, the roller clamp. And then this allows the tubing to be primed. So I just want to make sure that this is hanging at the appropriate length, allowing the solution to go all the way through. Okay, and then once I notice that my tubing has been primed all the way through, I can actually reclamp this and set this aside. So now that is primed. Now I'm able to come over here to my patient, and again, I'm just assessing for any redness, irritation, all that. And then I can come over here and grab the hub of their catheter here. So this right here was obviously touching the patient, so this is not sterile. So I'm just going to take an alcohol prep pad, and I'm going to clean this for 15 seconds and just really get in there. That way everything is as clean as it can be. So 15 seconds. And then once that is cleaned, I'm just going to keep a hold of this. That way it doesn't touch my patient. And I'll come over here and grab my syringe. So this right here is sterile because there is a cap on it. So I'm going to uncap this and take this syringe and attach it to the hub of the catheter. So once that is attached to my catheter, I am going to push about 2 to 3 milliliters of saline solution, and this will go into my patient, and then this is just priming the catheter tubing. So once I see that it goes all the way through, and it's about 2 to 3 milliliters, I can unscrew this and dispose of my syringe. Meanwhile, I'm still going to hold on to this because I don't want it to flop around and touch my patient. If it would, I would just clean it again with another alcohol swab for 15 seconds. So now I'm going to take the end of my tubing here, and I'm going to take this blue cap off. So now I can actually attach these two because they are both primed. So I'm taking off that cap. Again, sterile, clean, so clean technique. I'm going to attach this, and this is a Luer lock, so I'm going to push and twist. And then once that is secure, I can leave that there. I'm going to come back to my clamping, and I'm just going to release the clamp, and this allows the solution to go through the tubing into the patient. Again, I'm just going to calculate the drop factor per physician's order, and then use the primary solution at the appropriate flow rate for my patient. And then once that is done, I can remove my gloves and wash my hands. And then I will document my findings, if there's any abnormal findings, document my procedure, and then I will monitor my patient about every hour to see how they're doing.